Hi guys, it's Anna. I'm just going to share with you about the shoulder replacement. So this is it here, as you can see. Sorry, I can't point to it because my hand's in the sling. So I got my right shoulder replaced. It's probably been about 5 weeks now post-op, actually coming into 6 weeks. So the procedure went very well. Thank God. I went in on the day of surgery. So it was a Friday morning, went in early and seen the receptionist, just checked in, and I had like a bunch of doctors just come over and ask questions, or like how I am, and just confirming the arm, and you do, let's see what else, urine sample, and basically you're just waiting around, and every so often like a nurse or a doctor's coming over asking questions. So that was probably early in the morning, about 7, so till about 7:30, just constantly different people coming over. Then I just had to wait until I was called, and there were other people in the room. My poor husband's getting starving, so I said to him, go get breakfast, there's nothing else you can do here. So he went off then anyways, and I was called. Well, he went off when I was called, and that was it. Then I went on brought down to the theatre, and as I was walking down, the nurse was flying, the assistant person was flying, or student nurse, and my foot was killing me. I was like, I'm here going in for a shoulder surgery, but my foot is in bits. So trying to get down to the operating room is like hopping on my feet, on my foot, like. And so anyways, went on in again, asked more questions, and coming from a small island, turns out that nurse was from my hometown as well. Anyways, went on into the theatre room to prep, lie down, and they put like a blanket on you just to warm you up, kind of, which was good because I actually remember going in for a procedure before and just shivering with the cold because you're probably a little bit nervous as well, or the adrenaline, whatever. So they put this lovely heated blanket on you, and then they gave me a drip into my hand, or a wee needle, the butterfly needles that she said my veins were so small that I actually had to get a premature baby one, so just a little one was just put in here. And then that was it, really. I actually don't really remember too much. Just there was, oh, actually, sorry, saying that, no, she did push, there was like a needle has to go into the neck, so basically it was like this nerve blocker thing. So whenever the operation was over, my arm would be completely numb, so I wouldn't actually feel the pain of it until a couple hours later. So she put that in, and she said it was a weird thing. She says a weird sensation. Your leg will start to like tremble, and then they know they've kind of hit near enough the right area or something. So of course my leg starts shaking, and she's like, "Okay, we've got it," and then they blocked it. So that went in. Then they put the anaesthetic in, so then I completely just was out. And I remember looking at the clock, and it was 11:30, and then just waking up, and they were trying to wake me up, and we're just like, Anna, it's done, you're getting an x-ray. And then I was still like sleeping, and they're just remember them kind of moving me a bed and taking an x-ray. So obviously I was in the x-ray room, but I couldn't see it because I was still asleep. I could just hear all the noise, and they were just moving me from one bed to another, and maybe putting, I guess, some covering me up when they were taking x-rays. I'm not even sure. Then, but because I'd looked at the clock and it had been 11:30, my initial reaction was like, half asleep, was, what time is it? And so I'm like, what time is it? I just remember the nurse or somebody just saying it's 3:30. So I was like, okay, it's 3:30. And then they're wheeling me back to the room. Now they put me in the HDU unit, which the high dependency unit, just because of having this blocker in my arm, because then once that wears off, then like, ow, it'd be really, really sore. So I was in that room, and then just kind of vaguely waking up and seeing my husband there and stuff. So he was saying, as they wheeled me back, he was just like, oh my gosh, like what's going on? Because obviously you have all the tubes, and you have drips, and you have everything, like the breathing tube and like mask, oxygen stuff. So anyways, he thought like something went wrong, but obviously it's just normal to have all these things. During the operation I would have had a breathing tube down. Obviously I didn't feel it, thank God, because I got a gag with them trying to put that in. So when I woke up, then I just remember being so thirsty, and I constantly was drinking, but this arm couldn't move, and then I just was so weak after the surgery. So my poor husband John, they had to keep like giving me, you know, the straw, I think, and drinking the water, drinking. And then eventually a couple hours later, I kind of woke up and I was like, I want my tea and toast. But it was tea time anyways, like, well, dinner time, like in the evening. And so they tried giving me some other food, but not they did. I requested it. I said, ah, sure, I'm hungry, so maybe I'll go with chicken goujons, but absolutely no way. So one little bite of it, and I was like, oh, so it's too much on the body. So eventually got some tea and toast, I think. We went with it. I got my cup of tea anyways, most important. So that was it. You're kind of in now to sleep, and I just want to sleep the whole time. And so the anaesthetic anaesthetist came along, and the doctor as well, just to check on me a couple hours later. And again, I was completely out of it, so I don't even remember exactly what they said, but I know the anaesthetist was just saying how it was a little bit of a tough procedure because it was really, really worn, the joint. And she just kind of was trying to explain what she'd done, but half out of it, I couldn't really understand it. And then the doctor came along, and half out of it, I goes to him, can I see it? I was like, can I see the bone there? And he's like, oh, we had to get rid of it, but had I known you wanted to see it, I would have kept it for you. So I just was like, next time. So anyways, needless to say, I had a good sleep. Actually, not even just that day, but for like the next couple of days in hospital. The medication that they give me, probably codeine, morphine, painkillers, whatever, just really helped to just relax the body and have a good sleep. The next day, it was probably about 5 a.m. and that's when it kind of wore off the block, and then I could start to feel the pain like that morning. So obviously being in the HDU, you would have like the nurses kind of were standing over your bed a lot. They were constantly checking on you. There was only I think 3 or 4 of us even in that room. So yeah, I can just say I got my painkillers as soon as I needed them, and so that was great. And then surprisingly, like obviously I hadn't gone to the loo in a couple of hours, and I usually would have to go a fair bit throughout the day. So surprisingly, even though I was drinking, like God knew I just wasn't fit enough to go to the toilet, so my bladder held all the way until like 9 p.m. The Friday of the operation. Like, so they kind of helped go to the loo as well, bedpan, or not bedpan, is it? The one where they bring it over to you in the wee chair. So it just made it a lot easier. Like, there was a lot of attention, a lot of help, and obviously good painkillers and everything. I could have even gone home the next day had I been quite ready. Maybe if I didn't have that nerve blocker thing there, I probably could have. So obviously it depends if you're getting one, what your doctor says, and what they put you on. That was the Saturday. So I actually didn't go home until the Monday, because then on the Sunday they were like, yeah, you can go home probably then. But when I woke up, I felt really weak and I got sick. It could have been the medication, it could have been just numerous things. It doesn't mean anyone else who has surgery will get sick. So they just kept me in a little bit till the next day really. But I was so tired and so exhausted, all I really did was sleep. They actually put me in my own room, and so obviously in Ireland, most people will be in like a public ward, so you're in a room with like 6 other people or something normally. And so I've always been like that, which is grand because I'm a chatter and I just love talking to people, so I was fine. So when they told me, oh, you're probably going to a room on your own, I was like, huh? Because I'm like, oh, well, I love chatting to people, but that's okay. And it was probably right, because all I did was sleep. And the hospital was just an orthopedic hospital, so people weren't like sick, they were in there just getting a procedure done, such as knee replacements or hip replacements. So yeah, so I probably was the only one who was kind of like out of it. I don't know. I'm normally not like that, so it's just obviously the medication and the pain and everything just made me very, very, very sleepy. But I did have my hips done. Anyone who knows me, I would have had my hips done. It was 12 years ago. So as soon as I had my hips done, I got out of the bed straight away, and it was no problem. I got out, and you're on your crutches and everything. So this time, I don't know, I just expected it to be the same as the hip replacement, in the sense that I'd be fine straight away, it'd just be a bit sore. But it wasn't. The shoulder, very, very different. So it was a lot of pain after it, and just very uncomfortable. And the excruciating pain did last, I'll be honest, probably for like 3 weeks. Um, so I just didn't expect that, I think. I thought I would just bounce back. Now, obviously, it's 12 years later and I am a bit older as well. I was only 22 getting my hips done, and so I'm 34. Just turned 35 the other day. So, yeah, it was quite different than the hips being done. So much that I was like, I'm not getting the shoulder done, no way, no way. But now that it's a couple of weeks later, like the pain's definitely subsided, and you know, it was a bit uncomfortable still for 4 or 5 weeks. But now that I'm going into week 6 now, it's definitely a lot better, and then I start physio now in 2 weeks. So that's really what a shoulder replacement kind of is, well, my experience of it, you know. The scar is really small, actually, right here. This is it. This is probably just sunburn. So it is quite small, and it's really, really like healing nicely. I actually, like say, expected it to be here, and a lot bigger. So this went really, really well. 2 weeks after coming out of hospital, you have to go to your GP, and they just have to check the wounds, that there's no infection, and just how the stitches are. So obviously they took off I took off the plaster myself every few days, you know, and keep it on. So until the wound was closed, which it is closed, then the bandage then came off then entirely. So the stitches just kind of fall out themselves, or I don't know where they went. Anyway, I don't need to take them out, or I mean the doctor doesn't need to take them out, so they just fell out. So that was grand. Do expect, if you are getting shoulder replacement, I do expect that, you know, you really can't move your arm at all, and any little slight pain or movement or sudden jerks will hurt it. When I got my hips done, I was, you know, 22, and they were going to shower me, and I just was having none of it, you know. But now that I'm a bit older, and I was like, okay, I can accept help. So they do help you to shower in the hospital. And even when I come home, you know, like I say, it's almost 6 weeks later, and I still have help getting showered. Excuse me. I went and stayed with my mum for the first few weeks because I needed a lot of help with everything, and obviously I have a toddler, so a lot of help with him. And my mum's bed was so much bigger for me to sleep in, so I had a lot of cushions around and just rest in the arms. So find a comfortable chair to sit in after. Soft couches are quite hard to sit in and get up from, you know, especially if you're thinking. So find a good place to sit and rest for recovery, because that's all you can do is just sit or lie down and just rest. You really can't do much, and don't try to do too much either. You know, it's probably in us to like do stuff. Even if I come back to my house and I'm like, the house is dirty, I need to clean out. But you know what? It's just around 6 weeks of resting. Then you start physio, and then soon you'll be back to your normal life. So just take this few weeks, I should say, not moment, these few weeks to just recuperate and rest. So if you are having a procedure, the very best of luck to you. If you have any questions, my email is up there. So you can send me an email or comment or something if I get back to you. So best of luck with your procedure, and if it's not shoulder replacement, good luck with anything else you're getting done. And take care. Bye.